Countless soldiers have suffered from infectious diseases throughout history. Thus, military medical research is critical to sustaining the force. Since health and strength are keys to the stability of the armed forces, it is essential to maintain strong program focus on medical prevention, treatment, and innovative infectious disease research. Following the 1958 cholera epidemic in Thailand, the Southeast Asia Treaty Organization, or CITO, established the CITO Cholera Research Laboratory in Bangkok. Upon successful completion of the mission, the CITO Committee changed the name of the institute to the CITO Medical Research Laboratory, a collaborative institute between the Royal Thai Ministry of Defense and the U.S. Department of Defense. Then in 1961, the Royal Thai Ministry of Defense endorsed this entity as the CITO Laboratory, consisting of Thai and U.S. research components. In 1977, following the dissolution of CITO, the CITO Laboratory was renamed the Armed Forces Research Institute of Medical Sciences, or AFRIMS. Initially under the Office of the Supreme Commander, it was later transferred to the Royal Thai Army Medical Department. Currently, it's under the command of the Praman Kudklao Medical Center. The Royal Thai Army AFRIMS, or RTA AFRIMS, is responsible for directing the coordination, collaboration, and implementation of research, the development of health science and military public health, the production of medical audiovisual material, the training of personnel providing medical services to the Army, Navy, and Air Force. The infrastructure of Royal Thai Army AFRIMS is comprised of three divisions: the General Affairs Division, the Research Division, and the Analysis Division. The mission of the General Affairs Division is to support the RTA component in following RTA policy, which includes administration, personnel, planning and projection, documentation, welfare, finance, logistics, engineering, transportation, security, and information technology. These functions support research activities including collection and organization of research data and topics of interest that can be disseminated to the general public. The Research Division primarily focuses on studying infectious diseases of military importance that impede military operations and national security. This division is composed of epidemiology, microbiology, and pathology sections. Infectious diseases of interest are arthropod-borne diseases, malaria, rickettsiosis, sexually transmitted diseases, HIV/AIDS, and respiratory infections. Research projects have been conducted actively both in military areas of operation and in laboratories with standard accredited quality assurance as certified through College of American Pathologists, CAP, and ISO 15189 national standards. Research areas include epidemiology, immunology, serology, test kit and vaccine development, as well as drug trials. Geographical Informatics Systems, GIS, is applied to further research data analysis with geographical information resulting in GIS digital maps as well as web-based applications, fulfilling the national policy of Digital Thailand. We also collaborate with local and international research organizations, as well as both government and non-government agencies. Our highly productive research findings are well recognized nationally and internationally, as shown through publications in famous scientific journals, outstanding research awards, and some works registered as intellectual property. The Analysis Division is responsible for performing studies that will promote the health and welfare of soldiers. The division comprises biochemistry, narcotics and toxicology, production and standardization control, and laboratory animal sections. The biochemistry section provides medical checkup services at the bases for Royal Thai Army personnel in Bangkok and its perimeters following RTA policy, and provides personnel with medical advice on health promotion according to the Routine to Research program. The Narcotics and Toxicology section is the reference RTA unit that conducts analysis and research on drug addiction in military personnel by identifying exposure to morphine and its derivatives, marijuana, cocaine, as well as performing screening tests, drugs of abuse test kit research and development, and confirmatory tests with an analytical method that combines the features of gas chromatography and mass spectrometry to identify different substances within a test sample. The Production and Standardization Control section is responsible for all occupational health studies, toxicology studies, and other environmental surveillance programs to determine factors that may affect the health of soldiers, leading to better environmental quality improvement in the workplace. The Laboratory Animal section conducts research on zoonotic diseases that might impede military operations. This section is well equipped with a state-of-the-art laboratory that performs microbial isolation and evaluates medical equipment such as wound healing and blood clotting devices. In addition to research and laboratory services, RTA AFRIMS has also set up an AFRIMS Special Task Force with missions such as mobile laboratory investigation with a rapid van to support disease investigation of Royal Thai Army Medical Department. The United States Army Medical Directorate AFRIMS, or USAMD Rare AFRIMS, is an infectious disease research institute under the command of RARE, the Walter Reed Army Institute of Research, which performs expeditionary infectious disease research leading to medical biocountermeasures. The USAMD Rare AFRIMS consists of the following departments: enteric diseases, entomology, immunology and medicine, retrovirology, veterinary medicine, virology, epidemiological disease surveillance, and administration. The Department of Enteric Diseases focuses on modern surveillance, diagnosis, and preventive efforts against diarrheal diseases in Southeast Asia and the world. Many of these pathogens are increasingly antibiotic resistant, a growing and serious global health concern. Extensive international collaborations with civilian and military partners provides relevant and timely assessment of these diseases, improving health outcomes. The Department of Entomology conducts vector-borne disease research against malaria, dengue, Zika, scrub typhus, and leptospirosis. The department also conducts applied research to evaluate novel mosquito control methods, including repellents, insecticides, and vector barriers. Vector surveillance and spatial and temporal analyses of vector-borne disease transmission is conducted in the field, while in the laboratory, entomology staff support drug and vaccine evaluations to better understand vector pathogen interactions using mosquito, sandfly, and chigger colonies. The Department of Immunology and Medicine conducts research on malaria, focusing on the development of new antimalarial drug and vaccine candidates, post-market evaluation of approved antimalarials for continued efficacy and safety, and surveillance for malaria drug resistance. The department has produced every antimalarial preventive medication ever fielded, as well as the world's first malaria rapid diagnostic kit. The Department of Retrovirology protects the U.S. military from human immunodeficiency virus, HIV, and improves global health by conducting research to develop an HIV vaccine, reduce new infections, and find an HIV cure. To accomplish this, the department staff applies a product development mindset to non-human primate as well as human studies, ranging from observational to phase 3, coupled with diverse, state-of-the-art laboratory analyses. The Department of Veterinary Medicine operates the largest U.S. Army laboratory animal facility outside the United States, with full accreditation from ALAC International. The department provides veterinary medical expertise and maintains colonies of non-human primates and rodents used in testing vaccines, new therapeutic drugs, and diagnostic assays. The Department of Virology conducts a broad-based research program in emerging diseases to include epidemiology, pathophysiology, molecular evolution, animal studies, and human vaccine trials. Major regional pathogens of interest include dengue, influenza, Japanese encephalitis, chikungunya, Zika, and others. The Department of Epidemiological Disease Surveillance supports the public health mission of global infectious disease surveillance by consolidating respiratory disease data from 19 countries to include Thailand, Cambodia, the Republic of the Philippines, and Nepal. This respiratory surveillance product augments existing training and expands and fills gaps in knowledge voids. The Administration Department supports AFRIMS research efforts in the following areas: logistics, military and civilian personnel, resource management, information management, library, audiovisual support, public relations, Thai and English language instruction, quality assurance, biostatistics, occupational health, radiation protection, and biosafety. Today, the U.S. Rare AFRIMS proudly provides extensive experience in conducting high-quality, GCP-compliant field studies throughout Southeast Asia. In Thailand, AFRIMS maintains several well-established clinical study centers beyond Bangkok with more than 3 decades of successful, cutting-edge research. AFRIMS efforts have directly led to the FDA licensure of 2 Japanese encephalitis vaccines and the hepatitis A vaccine, saving millions of lives globally. AFRIMS also maintains major regional field sites in Nepal, the Republic of the Philippines, and Cambodia. Finally, AFRIMS continues ongoing engagements in Bangladesh, Laos, Bhutan, Vietnam, Mongolia, the Maldives, and South Korea. Since 2005, AFRIMS has earned the designation as a World Health Organization collaborating center in the Southeast Asia region for emerging infectious diseases. As a collaborating center, AFRIMS gains increased visibility and proud recognition of ongoing research development. For over half a century, the Armed Forces Research Institute of Medical Sciences has made significant strides in infectious disease countermeasure research. AFRIMS is a critical service support activity of the Armed Forces, safeguarding the health and strength of its warfighters. In support of soldier health, AFRIMS improves world health.